everyone, my name is Becky. I'm a nurse practitioner here at Garcia Facial Plastic Surgery, and I'm here today with Dr. Garcia and Lori, our esthetician, to talk about wrinkles. And wrinkles are something that affect everyone at one point or another, and some people aren't bothered by them, but as I'm sure you both hear people say, that sometimes they feel like they look sad or tired, and they feel great. And they want to look as great on the outside as they feel on the inside. So we have a lot of different treatments for wrinkles, and some of the ways that we choose how to best treat a wrinkle is by first determining what kind of wrinkle it is. So Dr. Garcia, can you tell us a little bit about different kinds of wrinkles and how they form?
Sure, there's two types of wrinkles basically. There's dynamic wrinkles and static wrinkles. Static wrinkles are the wrinkles that you see on the face when there's no facial motion, the lines that you see at rest, so to speak. Dynamic wrinkles are the wrinkles that are formed during facial motion. So the treatment is essentially the same for both, but the lines that are formed during facial motion sometimes can be treated with things that you do, for example, the neurotoxins and those kinds of things. With dynamic wrinkles, my treatment is to resurface the skin. We resurface the skin with one of two processes, either a chemical peel or dermabrasion. And essentially both of these procedures are akin to sanding a scratch on top of a table. If you have a scratch on the table, you want to sand down the level of the table to where that scratch starts, in this case the peel or the dermabrasion, and then you varnish over that scratch and the scratch looks much better. In this case, obviously, we're not varnishing, we're allowing the skin to heal, and during that healing process the skin is thicker, it has more collagen, and of course the depth of those wrinkles is significantly reduced.
Okay, so that sounds like a great treatment option for people who have more moderate to severe wrinkling.
That's correct, yes.
And can spare some downtime after the treatment.
That's exactly right, yes.
So what about treatments for people who don't have a lot of downtime and have maybe more concerns with fine lines?
Sure. So one of the things that we start with first is typically our skincare. We want them to be on a medical grade skincare line that helps to support collagen and elastin. And we have a ton of products that can help with that as well. They can come in for a consultation so that I can customize things specifically for them. And then also I can do chemical peels as well. My chemical peels are not quite as I guess more downtime as you have for those, but you know, a working person's peel. So you might experience a little bit of flaking or dryness, but not really a whole lot of downtime per se that can't be covered up. Also microneedling, HYDRAFACIALs. People don't realize too with fine lines, a lot of times when the skin is dehydrated or just dry overall, if they hydrate that skin properly, then it kind of plumps the skin back up and those fine lines are not as noticeable as well.
Yeah, some of your before and afters from HYDRAFACIAL patients are amazing. The results from just the facial. Yeah,
absolutely.
That looks great.
Yeah.
And how about the microneedling with PRF?
Absolutely. So microneedling with PRF. So I do the microneedling, you do the PRF, and we can do those in combination with each other or separate. So creating those micro wounds on the skin to help stimulate that collagen production is always helpful because the collagen is the scaffolding that holds up our structure of the skin. So
I think you bring up a good point about collagen. It's all about collagen when it comes to the face. However you stimulate that collagen formation, whether you follow an aggressive process or whether you do something more conservative, it's all about stimulating the quality, improving the quality, and of course creating more quantity of that collagen, and that's reflected in a more youthful appearing skin.
Absolutely. Yeah. And it's always going to give a natural result because you're stimulating your own collagen.
Yeah.
Yeah, so I know I've noticed a huge difference in my skin since doing the PENS, peels, and PRF and using medical grade skincare regularly.
Absolutely.
Yeah, and then of course the treatments that I do for wrinkles, I use BOTOX, which helps with the dynamic wrinkles because it relaxes our facial muscles so we're not making those strong expressions that cause wrinkles. We also have a line of hyaluronic acid fillers, which we can use to replace any lost volume or fill in any creases or wrinkles. And those are a pretty quick and easy treatment that can make a pretty significant difference in people's appearance.
Absolutely.
That's right.
Absolutely. Yeah. I feel like too, we need to highlight that, you don't have to wait until you're 40, 50, 60 to start doing these types of things. Really in your, late teens, early 20s, you want to start doing this ahead of time. It's a preventative thing. It's called anti-aging because it's, working on it before you actually start seeing those effects of aging.
Absolutely.
So getting on that good skincare, the medical grade skincare, and then, HYDRAFACIALs regularly, even having a microneedling treatment in your 20s is a good thing.
Absolutely.
I always talk to patients about slowing down the aging process, even someone who's in their 20s. My own daughter, who's not even 20, has facial treatments because I know the value and the importance of slowing down that oxidative damage that you incur on your skin throughout life, whether it's through sun exposure, whatever it is. And so if you can mitigate that damage younger in life, then your particular aging process is going to slow down. And when you're 30, you're going to look 20. When you're 40, you're going to look 30, and so on and so forth.
Yeah,
so to your point, I think it's very important for people to follow the things that you do and the processes that you offer.
Absolutely.
Absolutely, yeah, that's going to work in conjunction with any other treatments that people do. And, if you are looking for anti-aging treatments and you're not sure exactly what it is you need, that's okay too. You can come in and meet with us and we'll work together to kind of give you some different options and figure out the best treatment plan, for you individually. And I think that's really one of the special things about our office is that you get the expertise of different providers. You get some different options, and really we can put together something, that's going to help you the best in the long term.
Absolutely.